No, I am not in my bedroom or in my pajamas, and I'm ready to have a good conversation with each one of you. All right, excellent. As we wait for more participants to log in, again, I'd just like to welcome everyone to this brief conversation. We have a very short time. We have an hour and a half, and this conversation is not only taking place okay. Apologies about that. Asimwe, we can use the chat just in case there's a problem, maybe with my audio or something. Just drop me a message in the chat. I will be able to see it. Okay, I was just letting you know that there are conversations exactly like this taking place in other countries on the continent. So whereas in Uganda, we're focusing on promoting transparent COVID-19 data governance in the country, other countries have, country-specific themes. And all right, let me just excuse me, let me just get in touch with someone at CPESA because they're trying to reach me. So I'll just mute for a few seconds. All right, again, apologies for that. If I may just check with us again, can I be heard? Because I just received a phone call from somebody who says they cannot hear me.
On my side, I can hear.
Okay, so I think the person is the one who has an issue. Well, thank you very much for the feedback. Sorry about that. And since our time is already flying, uh, unfortunately, we we're not able to have everybody introduce themselves, but it's important for us to know who is in the room. So I'd like to request that we use our chat room for each one of us to just introduce ourselves, considering that I have the privilege of moderating. I will tell you who I am. My name is Iguma Gabriel. I'm a lawyer and a journalist, and it's always a privilege to moderate discussions like this, where we focus on something very important: data, especially in this time, in this era. Data. Some people have even said, data is the new gold. Uh, Therefore, it's very important that we have conversations around how data is managed, how it's collected, how it's stored, and things like that. All right, so please, I put a message in the chat room. Please go there and introduce yourself. Importantly, your name and your institution. And if you would like to give us any other detail about yourself, please feel free to do so. I'd also like to let us know from the very beginning that this meeting is being recorded. Uh, so yeah, just so you know, we're not doing this behind anyone's back. So just know that we're recording this meeting. So maybe everything, you know, if you switch your camera on, what we see is what will be recorded of, you know, everything that's being said is on the record. And later on, if you'd like, you know, to have a record of this, you can request the team at CIPESA. They will be able to avail this. Second thing I'd like to bring to our attention is the fact that uh, we're doing a survey, and therefore we're going to have a link that's going to be pasted in our chat room. Please take the survey. I have taken it. It's not long. It will take you a maximum of 2 minutes. It's really around data. Uh, so please, just if you could take a minute or so. In fact, I'd like to request maybe a Simwe, if you could paste the link so that we can actually do that as we give maybe uh, the next 2 minutes for more people to log on, and then we can have our discussion. Thank you very much for those who have been able to send in your name and your institution in the chat room. It's very good to have you join the discussion. Asimwe or somebody else from CIPESA, could you please paste the link for the survey? I hope you've been able to see the link. I just shared it in the chat room. Please take the survey. It doesn't take long, probably a maximum of 2 to 3 minutes for you to fill out every survey question. So this would be a good time for you to, you know, take the survey, and then we'll continue with the discussion. All right, this will be a good time for me to share some housekeeping. Uh, just a reminder for each one of us to have our microphones on mute when we are not speaking, so that you know, there are no distractions from your end. Also, a reminder that we're recording the session today, so just take note of that. We don't have much time, so again, uh, I'd like to say welcome, and I believe this is a good time for us to get into this discussion. Would like to thank um, CIPESA and other partners for convening us to have this dialogue. Today is the Open Data Day. Not very many people know about Open Data Day. So I'll just say a few things about Open Data Day. The Open Data Day is run by the Open Knowledge Foundation, and it's an annual celebration of open data all over the world. It provides an opportunity to show the benefits of open data and encourage the adoption of open data policies in government, business, and civil society. This year, CIPESA and uh, partnering with the Open Institute have convened us to discuss uh, issues regarding promoting transparent COVID-19 data governance in Uganda. This is a timely discussion, and each of you was specifically invited for this meeting because you are a key stakeholder, and at the end of the day, hopefully, we will come up with, uh, some way forward, some things that each of us can do where we are at. In 2020, a year that really changed the way a lot of things are done. COVID-19 dominated people's lives. COVID-19 dominated, um, news, dominated and changed the way things are done. And it coming out of uh, Wuhan, China, it was key that information in relation to transmission patterns uh, was shared by China in order to help the world come up with an effective vaccine. These developments would not have been possible if China had not shared, full sequences of the COVID-19 uh, genome with the world in early January 2020. However, since that initial open sharing, the situation has become more complicated. In Uganda's case, I believe it was yesterday, we received our first batch of COVID-19 vaccines, and I think the COVAX arrangement, and there's celebration. However, there are so many unanswered questions. Now, especially for those who would like more information, I'm not even sure people know where to get this information from. Therefore, it's important that we are having this discussion at this moment. So I'd like to just go straight into, our panelists for today, who will be sharing on the theme that I already shared, open data and transparency for eco development. And first, I'd like to invite uh, Stella Alibat Alibatese. She's a director, National IT Authority, NITA-U, and I'm also informed that the executive director of NITA-U is logged in and following this conversation. Sir, you're very, very welcome. But now I'd like to invite Stella, who will speak to us about the state of the implementation of the Privacy and Data Protection Act of 2019. This law was passed was assented to by the president in 2019. What's its relevance in ensuring openness and transparency of COVID-19 data? Over to you, Stella.
Thank you very much, moderator Gabriel. And I thank all the participants who have attended this webinar. I just need a moment. I hope it's okay for me to share my screen.
Yes, it is.
Screen sharing is disabled.
All right, someone's going to enable you too. Okay, try and share again, Stella. I think you're now able to.
Okay. Can you see the screen?
No, not yet.
Okay, just a minute. Let me do this again.
Yes, now it's coming.
Now you
we
can
see the
see it.
screen. Yes.
Okay. First of all, I would like to thank CIPESA for enabling this conversation, not only on open data, but on the Data Protection and Privacy Act. For us at NITA, it gives us an opportunity to talk about this law and to create more awareness about data protection and privacy and what is expected of us as citizens, as businesses, as government. I'm glad we are here to celebrate Open Data Day. And as you rightly said, Gabriel, there are not very many people who know what open data is, and I'm glad you've already explained it to our participants. Now, we need to know, first of all, that as government, some initiatives have taken place to encourage open data within government. Some time back, the World Bank did an open data readiness assessment for Uganda, and it was largely looking at areas of performance for government. That report is available. If you Google the Open Data Readiness Assessment Toolkit on the World Bank website, you should be able to find it. And that report was very good in as far as it showed the status of government and its preparedness to embrace open data. Secondly, the Ministry of ICT and National Guidance prepared a draft open data policy, which we know once it has been approved by Cabinet, will be able to move us one step further in this journey. So my task today was to talk about the state of implementation of the Data Protection and Privacy Act in Uganda and its relevance in ensuring openness and transparency of COVID-19 data in Uganda. In introducing the Act, the Data Protection and Privacy Act 2019 came into force on 3rd May 2019. The Act comprehensively and adequately provides for matters on data protection and privacy, and it gives effect to Article 27 of the Constitution, which enshrines our right to privacy as citizens. So it is meant to protect the privacy of the individual and their personal data, and also regulate the collection and processing of personal information. We'll note that in many cases, especially when data concerns human beings, such as health data, and because we are also talking about COVID-19, the COVID-19 pandemic, you'll find that in many cases, especially for instances such as contact tracing, you really have to disclose the personal information of that individual to enable, first of all, curtail the spread of the disease, and also to provide treatment for those who are affected. So my view is that the law is very relevant in this subject, because health data is it's very sensitive data, and also touches human beings, so to speak. Now, why is it relevant to this subject? I think it's very relevant because it provides a legal framework within which those who are utilizing open data or those who are actually disclosing that data can work within. Previously, when the study from the World Bank was done, we did not have a law. So while it recognized that one of the hindrances of embracing open data is the fear to infringe on the citizens' right to privacy, there was no specific laws that would be able to guide the actors of players in this area. I think the Act gives us an opportunity to know exactly what is expected of us, and having known what is expected of us, it then makes it easier for us to navigate so that we all achieve the same objective. I had an opportunity to look at the declaration that is being advocated by CIPESA and its other partners. And I believe there's no contradiction between that declaration and the Data Protection Privacy Act, as I'll enumerate. Now, the law provides for the rights of data subjects and provides for fundamental principles of data protection. One of the rights of the data subject is the right to access personal information. For instance, if a healthcare organization has information about me, it is my right to find out what information they have about me. It is my right to prevent further processing of personal data, which I think is likely to cause damage or distress to me. It is my right to prevent processing for my personal data for direct marketing. In this case, you'll probably have, Gabriel talked about the vaccine coming on. I may not want messages that are telling me, go and be vaccinated. You can find the vaccination here. You can pay this amount of money and get, the vaccine. So I have a right to prevent processing of my data for that effect. I have a right to correct inaccurate personal data. And then, of course, rights in relation to automated decision taking. In some cases, for agencies to be able to do this, they will need the use of open data. Now, what is key about the Data Protection and Privacy Act are the 7 principles that it talks about. When you look at the declaration that is being advocated by CIPESA and its partners, much of it actually addresses some of these principles. The first principle is that whoever collects data or processes data must be accountable to the data subject. And this is where we talk about things like, when you're collecting that data, are you giving me all the information I need? Are you transparent in the way you're dealing with my data? When you collect this data, do you use it for the purpose for which you collected it? Secondly, it must be lawful. Within Uganda, we have the Access to Information Act, which was done to provide the citizens' right to access information. But that act still prohibits the disclosure of this information if it will infringe on the privacy of an individual, or if it will if it is something against national security. Number 3 is probably maybe one of those principles that may impact the adoption of open data principles, because it talks about minimality. Under data privacy, you only collect what you need, what is adequate, what is relevant, and what is necessary for the purpose for which you're collecting this information. Now, open data may require that publish whatever information is out there, but I'm sure we can still work with within the framework and be able to agree what can be disclosed and what cannot be disclosed. Once this data has been collected, there must be a retention period within which you keep this data. The other principles refer to quality, the quality of data you're receiving. If you're going to utilize the open data portal and you're going to be able to develop applications, to develop solutions that will help humanity, you need good quality data, you need authentic data. The sixth principle is transparency, and I think we'll discuss transparency a lot as we go through this webinar, and of course, security. So I think if we expose and make use of these principles that are provided for in the Data Protection and Privacy Act, we'll be able to have open data policies that are comfortable not only for government, but comfortable for the citizens and everyone else who wants to use the data. In terms of the status where we have reached as of now, the regulations have been completed and are awaiting publication. Regulations for those who are non-Ugandans. Normally when we draft our laws, we have the principal law, which is the Data Protection and Privacy Act, but in many cases it provides open principles. The regulations go down to the detail and guide the agency that is implementing, the regulated community, the data subjects on exactly what needs to be done and how they can navigate the law. The setup of the office has commenced with the recruitment of the relevant officers of the office. It should be noted that within the Data Protection and Privacy Act, Parliament set up the National Personal Data Protection Office, which will be an independent office for the purposes of regulating data privacy, but within NITA, which is an existing organization. So the setup of that office has commenced. The authority has been conducting awareness, and one of them is this opportunity that has been given to us by CIPESA. We've been engaging organizations within the insurance industry, within the banking industry, within government agencies. Those we know hold a lot of personal data and very useful personal data. We are also handling complaints addressed to the authority. We are receiving data breach notifications and the like, and the authority recently issued its first investigation report against a company that had been accused of disclosing personal data that it was holding. We've also joined a number of regional and global forums addressing data protection and privacy, because as you know, the enforcement of data protection and privacy is a global issue. It is not something we can do alone because of the ubiquitous nature of the internet and of the very many providers such as Facebook, Google, and the like, who provide services to us. So it's very important that we join these regional and global forums so that we have a concerted effort to be able to address any challenges. Other administrative measures are being undertaken by the authority to ensure the office is up and running by the next financial year. Of course, this discussion cannot go without us being aware of some of the challenges that are likely to face us, or we are actually already experiencing. There's limited awareness on data protection and privacy in Uganda, and I thank CIPESA for giving us this opportunity to talk to the participants. There's limited understanding amongst the regulated population of their responsibilities, that is the companies, the government agencies who are collecting personal data. The cost of compliance, especially on small businesses, may be high if measures are not put in place to address it early enough. And of course, the cost of implementation of the law is an issue where we have very many competing needs as government. What are our next steps? We want to develop guidelines and toolkits because we want to be able to enable those companies, those businesses, those government agencies to even do, self-assessments to make it easier for people to comply with this law. Creating awareness is very important. Capacity building for critical sectors such as health, funding mobilization for the office, and we also intend to do private assessments for selected sectors and develop compliance plans for them, because right now we don't know the state of each and every agency. It's very important for us to do these assessments and be able to address them going forward. Thank you very much, Gabriel.
Thank you very much, Stella, for starting us off and for giving us that information on the status of the implementation of the Data Protection Act of 2019. As you were sharing, I remember that earlier this week, one of the insurance companies where I have a policy sent me a link for me to update my data. And well, it didn't take me long to notice that they were trying to find out if I had suffered from COVID-19. They asked very many different questions, but that's what it was coming to. And, you know, it just got me wondering, you know, how much information about me, about us is out there, and do we know how that information is being used? Then all of a sudden, almost every place is collecting information about us now. You now, almost every place, you know, you try to access, you write your name, you write where you live, you give your phone number, they take your temperature, you test, you write your temperature for that day, and some even have more questions than that.
Sorry to interrupt, Gabriel, but you're not very audible. If you could move closer to your microphone or increase the volume, please.
All right, sorry about that. I hope now I am more audible.
Yes, much better. Thank you.
All right, excellent. Thank you. I'd actually like us now to move to our next panelist, but just a reminder to those who have not introduced themselves in the chat room, please go ahead and do that. Also, if you haven't taken the survey, the link is available. I posted it and so did Asimwe John. I'd like to find out, is Mr. Kajirita Atek from the Ministry of Health now part of the webinar, or is he not yet with us? Oh, excellent, excellent. I can see Mr. Kajirita is now with us. I'd like now to invite you to speak to us on how we can have equitable access to crucial COVID-19 data, treatments, and vaccines, and how this can be implemented in Uganda. Earlier on, I spoke about the fact that, you know, we received the first batch of vaccines, more are coming. There are questions about the vaccine, questions about how to access, what a person will need, what information will be taken before you can get the vaccine. But over to you, sir.
Good morning to you, Gabriel, and colleagues. I've seen a number of colleagues online. I'm excited to join this meeting. However, I'd informed the convener that it's a Saturday and I'm in the farm. So I'm a little bit, I'm on the journey, so I will take some small time. But I've seen Emmanuel Enebiona online. Should be able to tackle some other data-related issues that are relating to Ministry of Health. Okay, just to dive into the matter, like you commented, a lot of information will be needed from time to time from individuals. And for any developed country, information is the #1 tool that we can use to develop a country. So from time to time, you will see people asking you for information, relevant information, and sometimes it is even too much. They can even ask you for your grandfather and grandfather, like they were doing, I think, in the Ministry of Internal Affairs. But all this has an implication and it's for use. So in relation to COVID, because the question is on COVID, how do you access equitable information for COVID, treatment, vaccines, and all? One, whatever information we collect as Ministry of Health, it is relevant information. We collect it for a reason. We collect it to enable us perform our functions, enable us take a decision, enable us maybe derive certain statistics that we need. So certainly information will be collected. But maybe the question is, how does the security of this information, and how does the information, how do other sectors maybe access this information? There are several ways and several mechanisms. One, not every information that is collected is for public consumption. And you know that security, whatever, people collect information. So if I collect information maybe on vaccines, the people will take the vaccines, the age, the sex, the what, all these things. Do you have any previous exposure to certain diseases? Do you have this? Do you have this? All this information is not for public consumption, but maybe for public protection. I can use this information to drive statistics and actions that can protect the public, but not necessarily to ensure that this, to make it available for public consumption. So, but again, when you have information, and maybe there are certain other sectors or areas that need this information, then they should also access that information, if this information is public information. So I think we need to be striking balance and say which information is for national interest that cannot be seen or utilizable by other sectors or other countries, which information should be shareable so that it can also be used by the public, and it helps the public to know much, to understand better and improve their livelihood and health. And how do you balance all this? When you look at COVID information, we have generally collected too much information, and we continue to collect. But sometimes maybe journalists will ask you certain information, and you see that this one is not for public consumption, because people have different agenda, different interests. Some are not necessarily for promoting maybe the public health, okay, and education and maybe livelihood. Some are really literally for maybe demonizing government, demonizing the response, or really pulling out certain things that will trigger people to see certain areas. So we are also a little bit careful on who receives the information, how do you receive it, and what type of information that you receive. And that's why information remains a government tool. Like it is, we handle it in a way that it is like a security matter, and we can only channel what we think is good enough for public consumption. But I think we just need to balance, and I'm happy Nita is there. Nita is the main government body for that. They need to balance, and they say maybe this kind of information can be decoded and be given public. This kind of information can be decoded and given to agencies, to all these NGOs, and they use this purposely for public health promotion and use. So, Chair, moderator, sorry, I just a snapshot. I just wanted to give you a snapshot of all this, and then maybe it would be the work of Nita to see how equitably do we use this information. If information is collected, what type of information, who should receive it, when and how? Over to you, and thank you so much.
All right, Mr. Kajimita, just before you go, just in case we're not able to get you back as we have the discussion, has the Ministry of Health been prescriptive on, when this data is being collected from a person, maybe when they're going to get tested or what have you, what kind of information should be collected and how this information should be stored? Or does that go beyond the Ministry of Health's mandate?
You are low. Your gadgets. The volume is very low from your side. All my volume is full, but I can't get you proper.
Can you hear me now?
Yeah, very good.
What I'm asking is,
Yeah.
Does the Ministry of Health
Yes.
prescribe what kind of information, for example, health facilities should take from the citizens when they're probably getting tested for COVID-19 and what have you, and how that information should be stored and who it can be shared with? Does the Ministry of Health give this, these parameters?
Yeah, thank you for that. All the information that we collect, leave around the health facilities, we collect a lot of information even in investigations, in contact tracing. All these actions that we are taking, we are collecting information. And this information is prescribed. You don't just go and just ask from A to Z. No, there are tools. There are standard tools that are used. They are in line with WHO guidelines. They are in line with, I think there is also some code, standard information code for something that is prescribed and used. So it is not that you just get people and ask them correct information. So what type of information? They are prescribed tools, standardized tools, and the information you collect is in line with what the health needs to determine the further actions. So for example, a patient will not come, that maybe a suspect COVID patient will not come, and then I'm asking, who is your grandfather? That information is not relevant to COVID, okay? Or whom do you vote? Who did you vote in elections? That's not relevant to COVID. So we ask specifically questions that relate to that will, when that data is analyzed, will either help with public health promotion or will help that individual management aspects. Because if I ask, for example, I'm suspecting you have COVID, then I ask, have you ever suffered from, maybe do you suffer from hypertension or diabetes? So I'm looking at information that 50% of the people that have tested positive with COVID have diabetes. So what does that mean? Public health promotion and public health protection. And what does that mean to the individual person that has diabetes and has COVID? So that's the type of information, the type of data that we ask. And like I said, it is standardized and prescribed. So it's not just an open data collection. Over.
All right, thank you very much. There are some questions in the chat. We may not be able to respond to them, but yeah, in
But I can take them now. Let's go 3 or 4, no problem.
Let me just ask the one from Moses Owin. He says,
yes,
Ministry of Health should be able to explicitly address the concerns around technology-assisted contact tracing and
yes,
on COVID-19 data in Uganda, and the principles and the collection of such data, why the citizens should trust such processes, which has privacy infringement, among other concerns.
Yeah, I think that's very, very pertinent. And let me tell you, Gabriel, we have refused so many applications, innovative applications to handle contact tracing. Our contact tracing is still elementary contact tracing, where you use individuals. Like I come to your home and I say, how is you today? How many people did you see? What happened? What is this? Then I'm filling a form. That is what we are still using, even this huge COVID pandemic. The reason is most of the innovations that have been brought to us, the applications, are really, they have really something to do with personal data integrity and issues to do with confidentiality and security. For example, somebody would say, I have a tool where, for example, if you are positive now, a take is positive, and I dash in that data, then it will show me all the numbers, the telephone numbers, where, whom, and the places where I have been, and the people I have been interacting with. So you will see within a minute, I can know that Atek has been interacting with Stella, with Asimwe, with who, he was in Masaka, he was where. So you collect so much information, but extremely endangering other people's integrity, freedoms, and whatsoever. And we refuse some of these. Very, very innovative, very good, but we say no. I think this is not it. Any digital tool for contact tracing, they are still elementary, and we continue to really evaluate most of these where we think we should not be endangering other people's freedoms, rights, and data security. Over.
All right, thank you very much. Let's go over to Bernard Sabiti from Development Initiatives on data politics and COVID-19. One of the things I remember is before the elections, there are places where certain politicians did not want to go and get tested for COVID-19. Over to you, Bernard.
Thank you, Gabriel. Can you hear me?
Yes, sir, we can.
Hello,
Bernard,
Gabriel.
right. We can hear you.
Okay, thank you. Yeah, so I'm called Bernard Sabiti. I work for Development Initiatives, and our work is basically to promote equitable access to data and information. The issue of politics is very important because let us remember that data, just like any public good, is potentially a political weapon, depending on how it is used. So we know that data can be weaponized, it can be commodified, depending on the interests of whoever is in control of the data. Uganda is actually an interesting case study when it comes to data governance overall. I think we have robust legislation and the policies for information access, but the problem comes to implementation. Unfortunately, we still maintain laws on our books which directly negate the precepts or the aims of most of the access to information laws that we have. So we still have the Official Secrets Act, for example, from 1964. We have public service standing orders where government employees are by law not supposed to release certain information. And of course, we have several examples where some of the legislation intended for public good, such as the Computer Misuse Act, has been sometimes misused, excuse the pun, to target some people's freedoms. So it is absolutely correct that data is a political tool. When it comes to COVID-19, it's really been an interesting dynamic, and not just here in Uganda, but around East Africa. During elections, of course, we all saw those stories where people, every possible excuse was being used to stop certain political actors from doing certain things. We saw the Public Health Act being extended to include that now very common charge of an act likely to cause a deadly disease. Of course, it was for, indeed, you can, from the face of it, you can take it that the government really wanted to protect the people. But sometimes also you have to ask questions on intent. I think intent and proportionality, these are all important things. Of course, when you talk about information on the COVID, it's not just about the disease itself, but it's also about the transparency around the response to COVID-19. That, you know, transparency, for example, around the contracting that happened, that cash bonanza that we went through when the disease hit. You know, it's going to be interesting to look at the transparency around the eligibility for this vaccine that has come, for example. What kind of transparency is going to be there? We had an interesting dynamic during the early response where some of us who are interested in data were, for example, wondering what parameters the government was using to determine who was eligible for COVID relief, for example, food distribution and all of that. All of those are very important actions that are supposed to be grounded in hard evidence and data. So the politics around of data is actually now a full branch of people who study statistics today, because technology has really upended the whole data ecosystem. Right now, everyone is a potential creator of data. Some of people call it content creation. Everybody is almost a dispenser of data. It is no longer prerogative for the government only or public institutions as producers of data. And this creates a very fine line when it comes to regulation. So how do you regulate to make sure that you protect people's privacy, but at the same time, you walk that fine line to ensure that you do not jeopardize the right for people to access public information. So it is still a kind of a very tightrope to walk. But for Uganda, I think around COVID-19, really compared to the region, has done extremely well. I think the Ministry of Health website is one of the very best that I have looked at. I think they keep track of the numbers and they keep informing the public. There are countries, of course, as you all know, where you cannot easily find that information. Tanzania, for example, Burundi is another example. So yeah, so the question really is about how do you walk that line between protecting people's privacy, but again, not infringing on people's right to access data and information. Thanks.
Thank you very much, Bernard. And we're going to come back to you with questions and comments from participants. So I just encourage the participants, please use the chat room to send your questions and your comments. And I believe all of us are actually actively following what's in the chat room. I'd like now to invite Ms. Dorothy Mukasa from Unwanted Witness, who will be talking about how we can be proactive rather than reactive. And many times we have ended up being reactive in prescribing good practices. Dorothy, over to you.
Thanks so much, Gordon, and thanks to the previous speakers, the fellow panelists and the participants. Listening to the fellow panelists, everybody agrees that data is very critical in fighting pandemics, but we should also understand that if this data is misused, it can be disastrous to the safety of the people and the nation at large. So it's important that whatever data is being collected is also protected. And that's precisely what the data protection law, as Stella has enumerated, is supposed to be doing. Now, how can we be proactive, in instances where data collection is really involved and protecting people at the same time? I think following the law is one of those critical elements. Like Sabit has said, we have good laws as a country, but then implementation has always been a challenge. And this is also true to the data protection law that we have now. I've listened to Stella excellently presenting the law, but also listening to my colleague from the ministry, it shows a disconnect in practice, how the ministry is really going ahead with the collection of data without following the law. Now, if all ministries, government agencies and private entities are aware of the data protection law, because we can't run away from it now, because everybody, like they've said, everybody is now collecting data. How do we make sure that Ugandans and majorly data collectors from both government and non-government agencies are aware of the data protection and follow the law in the collection of data? I think this will go a long way in saving people's lives, but also ensuring the data, that data is available, information is available for people to be able to make the rightful decisions. There's emphasis on transparency. I think it's the most critical key principle when it comes to data collection and processing. Being transparent is very important. When you look at the month that we've gone through with COVID in the past year, there's been a lot of data collection, not only personal information, but a lot of information that's being collected related to the pandemic. But then you ask yourself, how transparent has the different agencies that are collecting this information been to the citizens of Uganda? How transparent, for instance, are we? How transparent has the ministry been in terms of putting out information that relates to people? We've seen on social media in the last year where personal information, health information related to COVID patients being put out in the public, and nobody knows where this information came from, for instance, and no action has ever been taken for that matter. So I think for us to be more proactive is to ensure that data collectors are really up to date with the data protection law. They know the principles before even undertaking data collection. They know the principles because we should agree that even in times of emergencies, international human rights standards do still apply. So even in COVID situations, we should as a country observe human rights standards, because then we want to protect people, not to endanger them. And protecting them means that we need to thoroughly follow the principles that are put forth to protect individuals as we go ahead to ensuring that we fight the pandemic. Thank you.
Thank you very much, Dorothy. And from what you've just said, who should ensure that these data collectors know the principles and should be following the principles?
I think it's a collective responsibility. As Stella was presenting, she mentioned the fact that NITA has embarked on this process. I should tell you that Unwanted Witness is highly interested in this process as well. And for us to go ahead and investigate data protection principles of certain companies like Safe Border and petitioning NITA was one initiative for us to show that everybody should know that they have a right. It wasn't a matter of exposing Safe Border's poor data protection principles, but rather to ensure that the millions of Ugandans who use Safe Border are aware that they have a right, when it comes to the protection of their personal data that they deposit with these Safe Borders. So I think it's a responsibility of all of us, in both in the sector, but also government, the government, NITA spearheading this. Everybody needs to be aware. They need to reach out to everybody to ensure that they are aware that they have rights, both as data subjects, because it's important. I know it's in the interests of the data collectors to go away with our data, But then it's also very important for data subjects to know that they have rights, to be able to hold data collectors accountable through the law. I think it's important on both ends, both the data collectors, but also data subjects. If we have an aware citizenry, I mean, it will go a long way for us to ensure that the data protection law is followed. But also if the data collectors, for instance, are aware that they are supposed to follow the law and they're under watch by the data subjects, they will definitely put their house in order to ensure that, it only makes good business sense for them to follow the law, but also, ensuring trust amongst the different consumers. So it's a responsibility of me and you, Gabriel, and Nita, Spencer, all of us have a role to play in ensuring that we create awareness amongst the people that are not aware of these rights, because technology is here. We are all using technology and all of us are collecting data, and this data is really harmful if not well protected.
All right, thank you very much, Dorothy. I'd like to go to Stella on the same, who is ensuring that the people that are collecting data know what they should be doing. Stella, were you able to hear me?
Yes, I was able to hear you, but do you just want me to talk about it, or you had a specific question for me?
Well, the thing is this, well, what has happened is from the beginning, everyone has said, it's everyone's responsibility, and then somehow chipped in that, but Nita, you should be taking a lead without directly saying it. So I want to find out from Nita, are you taking a lead on this?
Thank you very much, Gabriel, and to the panelists that have spoken so far. As rightly stated by Dorothy, we all seem to be agreeable. The issue is how to balance the two needs. Yes, we need a lot of data out there so that we can innovate, so that we can protect our population, so that we can make informed decisions. But at the same time, we must ensure the protection of privacy. Indeed, NITA by law is leading this journey. And as I indicated in my presentation, we are going to engage a lot of key sectors. Some of those key sectors that we've identified, and we'll probably share with some of the actors in this industry, are health, finance, education. Those are some of the sectors we know are holding a lot of data. Some of the things we are going to do with them, for instance, we'll be engaging the Ministry of Health to agree with them what protocols will they use. How can we ensure that the existing protocols they have already have privacy embedded within that? In my view, and I could be wrong, but Mr. Kajirita can speak to it, I believe the medical field is one of the those fields that already is cognizant of privacy of a human being, because they know that health data or someone's health status is a very sensitive matter. Now, I know that even when they are doing studies, they go through a process that also ensures the privacy of those individuals. They are very critical on the issue of consent. So it's not that they do not have anything. It's not that they are not mindful of these obligations. I agree with Mr. Kajirita. I have not seen any approved contract tracing technology that we've had. And as he said, when I saw that question in the forum, I knew that most of the contract tracing in Uganda rudimentary, as he elaborated. So yes, it's work in progress. The law was passed in May 2019. As you know, by that time, our budgeting for this financial year had already been completed. But in NITA, we are not sleeping. We are working actively to make sure that, first of all, we create that awareness everyone is talking about, that Dorothy is talking about. Because while our principle is that ignorance of the law is not defense, it is incumbent upon us as the regulators to make sure that we create that awareness that is necessary for companies or agencies to make sure that when they are developing their policies, they actually comply. Secondly, we want to do awareness, just like we are here. I knew by coming to this forum that I was going to meet, or talk to other people who will talk to other people about data protection. I don't know whether I could also respond to some of the questions that were raised, because some
Please
of
go
them
ahead.
are related. Patricia was asking about corporations that share personal data with third parties for economic gains. Our law specifically does not allow the sale of personal data. So you can only share personal data for a specific purpose that is actually communicated to the data subject. Indeed, it's true, there are a lot of obligations on the data subjects, because it's only the data subject who can know that their data has been shared irregularly. For instance, if I've shared my data with CPESA that I know is specific to CPESA, and then I find it with unwanted witness, I have a right to ask, unwanted witness, how did you get my data? Then if they say they got it from CPESA, I'm able to follow up. So there's a lot of responsibility on the data subjects. Now, for us as the regulator, our duty is to make sure that the people who are collecting this data or processing it are aware of their obligations. The second obligation is that we should go into these organizations and assess their policy and assess how they are dealing with the data to confirm that they are compliant. But where we are not able to see that information, the best source of evidence would be that data subject. So we need data subjects to know their rights and to enforce their rights. There was a comment from Mr. David Kugonza that government needs to promote the responsible use of personal data, and I agree with you entirely. I think his other comment was that government and that it should be transparent and accountable, and indeed the law requires you to be accountable. In other words, if you receive my data and you have to transfer it to someone else, you need to have recorded the reasons for that. I should be able to see if there was a request, where did the request come from? I should be able to see, did you go through some internal analysis to determine whether you could share the data or whether you needed to inform me first before sharing the data. So that is some of the accountability that we are talking about. Someone asked, how are we managing the individual data in the hands of saloons, border borders, malls, etc.? Right now, we've not started any engagement with these categories of people. Most of this was brought about by the regulations that were passed by Ministry of Health requiring collection of this data. However, in many cases, I personally, and this is a personal view, I even doubt the authenticity of that data, because I don't know who can provide, a border guy with their correct mobile number. So these are areas we are going to critically look at and address with the Ministry of Health. Have health workers been sensitized? We've not yet had an extensive program with the health workers. These are some of the things I talked about. Once the office is in place, and we get funding. We are mobilizing funding to be able to do our countrywide sensitizations. And we are looking initially, we are looking at those critical sectors that I talked about. Health is one of them. The JLO sector, that is the justice, law and order sector, is one of them. The education sector and others.
All right, okay, excellent. Mr. Kajirita, are you still able to hear us?
Yeah, I can get you.
Okay. Actually, the question that Stella just finished with from Michael Avoneka was actually to you on whether you've trained health workers on how to, treat people's personal data.
Yeah, just before I answer that, Mr. Moderator, I'm not a government spokesperson, but I want to assure the members here that all these agencies are doing what they can to the best of their efforts to really collect data for purposes of national development. I don't think there's any government agency that is collecting data for purposes of maybe negative development. So they do all what they can. We do our best at a given time to protect the nation. Now, the health workers collect data that is prescribed. The health worker will not see a patient and just start asking all what she wishes or he wishes to ask. There will be a tool. So there will be a tool and we'll be feeding that tool. And that tool will be a standardized tool. Most often, because we have a health information management system, we have all these data protection issues. There's a whole division for health information, the NITA tools, all these things. People are not just there for joking with people's information and data. Forget about that. But maybe what happened, yeah, really it's not like that.
Okay, speaking of the tools, Jackie Kemgisa, who is a journalist, asked whether these tools are open to the public and, where the citizens can find this information. Mr. Kajirita?
I didn't get that. Somebody was calling. Yeah, apologies, please. Just repeat it quickly.
So just in the submission you just made and earlier on, you referred to tools. And Jackie Kemigisa, who is a journalist, asked whether these tools are open to the public and where this information can be found.
Okay, that is one thing. But Gabriel, let me start from this one. When I look at my phone right now, it is saying recording, meaning that you are recording this whole meeting. Did you ask for me permission to record what I'm talking?
In the very beginning, I expected that we were recording. Yes.
Let's start. Me, I was not there, and I see myself recorded, and all what I'm saying is recorded. It can be used against me or for the benefit of the public. So that is what it is happening. Let us not expect this word to be, this is a word and all these things are there. We keep on every day improving. So now, if I don't think that all these tools can be available to the common person, no. So long as they are done for the benefit of the common person, then they can be utilizable. But if Jackie now is at another level, wants to see, but are these tools really helpful or do they not injure the common person? Then Jack should have a right to access these tools, and they're accessible. We are extremely very open. There is a whole, I think the HMR, health information management system. You can make a request and they will give you all, even some of them are on open data. You can access them at MOH website. And you should see them, critically look through them, and then you can even point and say, but this, why do you need this information, which may be injuring the people's whatever, privacy, etc. This is what we should be promoting.
We're running out of time. Could I just ask you, there's one more question here very quickly. You've answered part of it, but I'll ask the question the way it is. What's the contact tracing method used in Uganda? Did it include creating a database of numbers and contacts? Did it include tracing the movement of individuals through geolocation? Did it involve mining information from departments such as immigration? Like I said, you touched part of it. If you could just respond to the bits you hadn't talked about.
I don't know why this contact tracing thing, I've gotten a lot of interviews on it. I don't know what's the problem. The contact tracing method we are using, like I said, is elementary. What we do is that we have contact tracing forms, which are really trained officers up to the level of HTs, okay? From the national, the districts, down like that. They are trained. And these people, if you get a positive, then you go to this person and fill a form and also ask for the contacts of this person. Where have you been in the last, for example, 5 days? Whom did you meet? Where were you? Stuff like that. So you fill these forms and generate a line list. So you're going to say, I take Kajirita, who is positive now. I saw this, I saw this one and this one and this one, then I collect the information. Then now that is a line list of me. Those are my contacts. And you can even generate contacts of contacts, okay? And then you look for these people, you call them, you go to their homes, and also look at them and then lock them. You say, you know, there is a problem, you have been with Attack, and Attack has an issue. We are still monitoring, please comply. Be here as we continue to monitor. So it is still elementary, it is we keep on following these people for this prescribed time, and then we shed off that data. But yes, there is a database, but it's MOH database, and we shed off this data when our interest is over.
All right. Bernard, let me go over to Bernard. Bernard, there's a question from Michael. And this is really widening the discussion on open data. Oh, sorry, that's not the one I wanted. Let me just find, yes, the bigger question that seems not to be answered is what makes open data open? By its nature, open data has no limitation on who uses the data and what they use it for. And then later he talks about the fact that since it's open data, those who have access to use it and basically, use it at their own discretion.
Thank you. That's a good question, actually. I think I was also getting worried that we might be forgetting about that second element of this discussion, which is, it's an open data day, and the open data movement, basically, its principle is that data should be open as much as possible without restrictions as much as possible. But as I said in the beginning, I think technology has really changed the way data is collected and data is accessed and used. They are now calling it the data revolution. We are in the data revolution age. In 1994, the United Nations Statistics Division released a document called the Fundamental Principles of Statistics, which is basically what they envisioned at that time on how statistics should be collected on people. But now they've realized that because in 94, the internet wasn't really widespread, technology was still not very well developed. Even when you come to Uganda, the UBOS Act of 1998, which is basically our own statistics law, is now being reviewed because UBOS is also realizing that 1998 is a long time. There are things they didn't envision when they are writing that law. So basically, technology, as I said, had really taken data governance from the sole monopoly of government institutions and kind of democratized data access and data use. And as I was saying, the law in Uganda is robust in terms of supporting access to information rights from our constitution to the 2005 Access to Information Act, which was actually made Uganda one of the very first countries to pass a law like that. The Ministry of ICT has a draft policy on open data, and I think the colleague from NITA also talked about the open data readiness assessment that was done by World Bank about 3 years ago. Now, I believe, and this is really a very good platform because most of the key stakeholders are here, probably only UBOS is missing. I think we really need to be careful that in our attempt to promote data protection and privacy, we do not again limit access to information and the technology, because I believe NITA also among its mandates is to promote innovation and in ICT. So I think I'm generally not a big fan of over legislation. I think the fine line, as I call it, can be walked. When we talk about open data, we do not really mean that you need to release data that can be injurious to innocent parties. That one is obviously not even to be debated. At the same time, I'm worried that under the pretext of, saying, I think Dr. Kagirita kept saying that there are certain the information that cannot be in the public domain, which of course I understand. I'm a public policy analyst here and a researcher, and I'm always really looking for data. I love the DHIS2, that very good database of the ministry. And actually, to clarify on what someone asked, some of the tools, because the HMIS tools are also routinely reviewed and they have workshops on data quality all over. The Bureau of Statistics also, before they do any survey, sometimes they invite the stakeholders to contribute to questionnaire development and other tools. So there is participation on that front. However, I really believe that if I want data as a data user, the way things are here, despite all this good access to information we have, you have to write to the permanent secretary. I think the information, the regulation is say he has 21 days to respond to you. In this age of this crazy internet and technology, really, I do not think we should be making it harder for people to access data. And as I said, now we have so many stakeholders who even have more following. You have social media stars here who have more following than traditional news media, who can easily, spread surveillance information and these positive messages. I think we need to support them, of course, while making sure that we don't jeopardize privacy and all that. But I don't think the solution is to actually limit easy access to data in our attempt to enforce privacy and data protection.
All right. Unfortunately, we're out of time. So I'll just finish with Dorothy on that thin line, open data and protection of your privacy. How do we walk that thin line as a way forward?
I think it's really clearly stated that both principles of data protection and principles of open data, are clear on how the two can coexist. I think it's a matter of, for me, it's a matter of following the principles and doing the right thing, for both the advocates for open data and the advocates for data protection, as well as the different stakeholders that collect data, as well as data subjects. Because I agree with Bernard, information is very important. You can't bury information under the pretext of protecting privacy. I mean, the two can coexist, and through the principles, both principles of data protection and open data, we can strike a balance and ensure that lives are protected, but at the same time, information is available. Because if you're protecting privacy, you also need information to be able to protect the lives that are very critical for throughout the world. I mean, it's important to strike that balance using the principles, if I should say.
All right, thank you very much. And a big thank you to all our panelists. Unfortunately, because of time, we have to leave it there. But the conversation is continuing in the chat room. So please, your questions and your comments can continue in the chat room. All of us are still able to use it. I'd like now to go over to Dr. Wakabi from CIPESA on why the Restore Data Rights Declaration. Why is this important? Over to you, sir. Doctor, I don't know if the noise is coming from your end.
No, it is not. Hi, everyone. Wakabi here. This meeting of today has been organized in a number of countries by the Restore Data Rights Movement. And this is a movement that is working to improve the transparency, accountability, and inclusiveness of COVID-19 data use in Africa. So a similar meeting is going on in Nairobi, in Accra, and in Nigeria. I don't know which city that is. So the movement was launched. We had 2 launches last September. The first one was at the Forum on Internet Freedom in Africa, and then in November we had another launch. And what we are trying to do is to encourage very many entities, private sector, government, development actors, civil society, and individual citizens to join this movement so that we can all be able to play our part to make data rights, realized. COVID is what we are focusing on because of the nature of the data that is collected, but also because the COVID pandemic and the health emergency it has caused is something that has really affected very many sectors, not just health. So there are 3 basic principles, again, as said, that underpin this declaration. And those are transparency, as said, inclusiveness, and accountability. From the conversation that we have had today, I think we see that there are attempts by various actors that are involved in COVID-19 fighting to adhere to some of these principles, but perhaps there has been gaps in attaining some of them. So the declaration guiding actions for decision-making processes around how sensitive data are collected, shared, and used to tackle the pandemic in Africa. And we are saying, again, as said, they should be transparent, inclusive, and accountable. So we are calling upon everyone to join this movement by signing the declaration. If you go to the website restoredatarights.africa, there is a tab where you are able to sign the declaration as an individual, as a CSO, as a development actor. So please go ahead and sign the declaration. You can also send questions in case you have any to programs@spesa.org or send a tweet to spesa.ug. This movement is supported by a couple of other actors that are passionate about these issues, and they include the Foreign Commonwealth and Development Office of the UK and COVID Action, and the Open Institute in Nairobi is the anchor for the action that we are doing here. That is all for me. Please go ahead and sign the declaration. Thank you very much, or ask questions in case you have any.
Thank you very much, Doctor. Do we have any questions for Doctor? Also, Doctor, if it's possible, just put the link to the declaration in the chat so that people can go ahead and follow it in order to sign up. Any questions for Doctor? I'll just allow 2 or so minutes. Let me just check in the chat. All right, excellent. I see the link has already been put. So please just follow the link and sign the declaration. All right, I'll take it that there are no questions for Doctor. Well, would like to thank you all very much for participating in this discussion. Today being Open Data Day, it's good that we have conversations like this, but that we don't leave the conversations on these platforms, that we continue to engage. So in that regard, CIPESA will be following up, following up with us on a number of issues, but also for your time and your connectivity, CIPESA will also be following up on that. I realize there are some questions that were not responded to, but unfortunately we are out of time. We wouldn't like to throw the rest of your day off balance. So again, from me and from the CIPESA team and other teams involved in putting this discussion together, I would like to thank you for your participation. Until next time, goodbye.